Pleural effusion is a condition that affects the lungs. It occurs when fluid builds up in the pleural space. This space is found between the lungs and the chest wall. The pleura, a thin membrane, lines this space. When excess fluid accumulates, it can compress the lungs. As a result, breathing becomes labored. This condition can be caused by a variety of factors. These underlying conditions can range from heart failure to infections. Early diagnosis and intervention are key to managing this condition. Pleural effusion can stem from a variety of underlying medical conditions. One of the most common causes is congestive heart failure. This condition impairs the heart's ability to pump blood effectively, leading to fluid buildup, including in the pleural space. Liver cirrhosis, a condition where scar tissue replaces healthy liver tissue, can also cause pleural effusion. Kidney disease, particularly nephrotic syndrome, can also lead to fluid accumulation in the pleural space. Hypoalbuminemia, a low level of albumin in the blood, is another potential cause. Albumin helps keep fluid in the bloodstream, so a deficiency can lead to leakage into tissues, including the pleural space. In addition to these systemic conditions, infections can also cause pleural effusion. Pneumonia, a lung infection, is a common culprit. Tuberculosis, a bacterial infection that primarily affects the lungs, can also lead to pleural effusion. Cancer, particularly lung cancer and cancers that have spread to the pleura, can also cause fluid buildup. Other causes include pulmonary embolism, a blockage in an artery in the lungs, and autoimmune diseases such as rheumatoid arthritis and lupus. Identifying the underlying cause of pleural effusion is essential for determining the most effective treatment strategy. Pleural effusion doesn't always cause noticeable symptoms.
This video was proudly sponsored by One Browser. Don't miss out. One Browser is the must-have tool of 2024. Try it now. Thanks, gentlemen. Let's get back to our lovely video.
When symptoms do occur, they can vary in severity depending on the amount of fluid buildup. One of the most common symptoms is shortness of breath, also known as dyspnea. This occurs because the fluid in the pleural space compresses the lungs, making it harder for them to expand fully. Chest pain is another common symptom, often described as sharp or stabbing, and it may worsen with deep breathing or coughing. This pain, known as pleuritic pain, occurs due to inflammation of the pleura. Other symptoms of pleural effusion include a persistent dry cough, fatigue, and a general feeling of discomfort. Some individuals may also experience orthopnea, which is difficulty breathing while lying down. This occurs because lying flat allows the fluid to spread out and compress a larger area of the lungs. If you experience any of these symptoms, it's important to see a doctor promptly for diagnosis and treatment. Early detection and intervention can help prevent complications and improve outcomes. Diagnosing pleural effusion typically begins with a physical examination. The doctor listens for reduced breath sounds or abnormal sounds like a pleural rub. A chest X-ray is usually the first imaging test performed to confirm fluid presence. An ultrasound may be used to get a clearer view of the fluid. Thoracentesis is performed to diagnose the cause of pleural effusion. A needle withdraws a sample of the fluid for analysis. Analysis can identify infection, cancer cells, or high protein content. Treatment focuses on addressing the underlying cause and relieving symptoms. For heart failure, medications and diuretics are used. Antibiotics treat bacterial infections, while antifungal medications treat fungal infections.